How does neuroplasticity help speech recovery after brain injury? Imagine your brain as a busy city where roads connect different neighborhoods. When part of the city gets damaged, some roads might be blocked. Neuroplasticity is like the city's ability to build new roads and reroute traffic so that communication can still flow. This process is essential for helping people regain speech after a brain injury like a stroke or surgery for a brain tumor. Right after an injury, the brain tries to repair itself through reactive neuroplasticity. This involves biological processes such as reducing cell death, creating new neurons, and repairing nerve fibers. The brain also forms new connections between neurons, which is called synaptogenesis. These changes happen mostly within the first 6 months after injury and can lead to spontaneous improvements in speech and language abilities. As time goes on, experience-dependent neuroplasticity kicks in. This is where therapy and practice play a big role. Speech therapy encourages the brain to strengthen existing pathways and develop new ones by repeating language tasks and engaging in communication exercises. This repetitive practice helps modify synapses and grow dendritic spines, which are tiny structures that help neurons communicate better. Recovery often involves the brain reorganizing itself within the damaged hemisphere, usually the left side for language. Sometimes, the right hemisphere takes on some language functions, but research shows that relying too much on the right side may not always be the best strategy. The goal of therapy is to reactivate and strengthen the original language areas in the left hemisphere, helping the person regain clearer speech and better communication. Therapies like intensive speech-language therapy or melodic intonation therapy are designed to harness neuroplasticity. They promote changes in brain networks by encouraging the growth of new connections around the damaged area and in residual language circuits. This process helps improve speech production and understanding. In cases of brain cancer or tumor removal, parts of the brain involved in speech may be affected. But neuroplasticity offers hope. Targeted speech therapy can help patients adapt by encouraging the brain to reorganize and find new ways to support language functions. Overall, neuroplasticity is the brain's natural ability to repair, reorganize, and adapt after injury. It provides the biological foundation for recovery, and with the right therapy, the brain can develop new pathways to restore speech and communication. Always remember, each person's recovery journey is unique, so working closely with healthcare professionals is essential to find the best approach for individual needs.